Welcome. My name is Dr. Dan Tomaszewski, orthopedic surgeon here at the Door Orthopedic Center. And I want to just take a moment to thank you for being here, both coaches and patients, for giving us your time and your attention so that we can give you some very important information as it pertains to joint replacement surgery. Hip replacement surgery has been around for many years, and it is one of the most successful surgeries that's performed. It's been performed since the 1960s with good and excellent results for the majority of patients. But like all surgeries, hip replacement has cost. Now, I'm not talking about financial cost, but rather the costs of risk, recovery, and rehab. My goal today is to give you realistic expectations about those costs. Now, hip replacement surgery typically involves either making an incision in the front or the back of the hip, which depends on the surgeon, the patient, and a host of other factors. And a hip replacement looks a little like this. It's a new ball, which is attached to a stem that goes into your femur, and a new socket, which is placed into the pelvis. So rather than bone grinding on bone, we now have metal or ceramic articulating with plastic, and it's much more comfortable. The surgery itself takes about 1 to 2 hours and typically involves a regional anesthetic, where the anesthesiologist gives you an injection in your back and then some sedation afterward, which can make it much more comfortable for you. In that way, we don't have to give heavy anesthetic medications that can oftentimes leave people nauseated or sick afterwards. Hip replacement surgery is typically done as an outpatient, and we begin therapy right away. We'll have you up and walking with the assistance of a walker and a therapist down the hall the day of surgery. We'll even have you do stairs before you go home. Now, hip replacement surgery is very successful. It absolutely eliminates pain from arthritis in the ball and socket joint. Unfortunately, that's all it does though. You'll have your own muscles, tendons, ligaments, nerves. All the soft tissues are still your own, which will absolutely still be sore after surgery, particularly immediately after surgery. You'll have bruising and swelling that takes time to recover from. Long term, if any of those issues become a problem down the line, a pinched nerve or a torn muscle, those can cause problems with regard to pain even around a replaced hip. A hip replacement is not the fountain of youth. It does not eliminate all pain for all of time. Additionally, there are certain risks with hip replacement surgery: anesthetic risk, infection, bleeding or damage to blood vessels, blood clot, nerve damage that can leave your leg numb or weak, fracture, limb length inequality, dislocation, mechanical issues like parts wearing out or loosening, all the way up to loss of life and limb. All of these things are possible after hip replacement surgery, and you must be willing to accept that possibility. Now, fortunately, even though these are very serious complications, any one of them are very rare. I'd like to spend just a little extra time talking specifically about some of these issues. Infection is the most worrisome of all these complications. We go through great lengths to do whatever we can to try to prevent that complication. Unfortunately, no hospital and no surgeon has a 0% infection rate. Many infections are caused by bacteria that are on your skin or in your body. Fortunately, our rate of infection is equal to or less than most published studies. This is a credit to your preparation, the OR team, and good fortune. An infection is a life-changing problem. It means long-term antibiotics, more surgery, and extended downtime. Next, I'd like to talk just a little bit about some of the mechanical complications after hip replacement surgery. When we do a hip replacement, there's no longer a tether or connection between the ball and the socket. As such, it is possible to dislocate the ball from the socket. Now, what holds the ball into the socket after hip replacement surgery are all the muscles that surround the ball and socket. And one of the things that we can do to try to limit the chance of dislocation is to lengthen the leg. If we lengthen the leg a little bit, we can put more tension on the muscles, therefore reducing the risk of dislocation. I always say I'd rather have a slightly long leg than take the chance of dislocating the hip after surgery. Additionally, when we put this stem into the femur, if you have thin or osteoporotic bone, it is possible to fracture or crack the femur as we do it. Of course, that's a very rare complication. All this information can be both scary and overwhelming. And it's our job to make sure through this talk, through the binder, through the class, and through your appointments to make sure you are fully aware and fully prepared. And we take our job seriously. And we are just as serious and just as committed to make sure that this surgery is as safe and as successful as possible. Now, if this information has made you second-guess surgery, know that you're not committed to anything and you are more than welcome to give it more time and more thought. That said, if this information has made you feel more enlightened, more empowered, and more ready to live life without arthritis pain, then I want to congratulate you and thank you for choosing the Dorr Orthopedic Center team to help take care of you.
Hi, I'm Dr. Brett Young, and I'd like to highlight some important things to know about knee replacement surgery. We want to help ensure that patients have appropriate expectations regarding the knee surgery and recovery. It's important to keep in mind that each patient is unique in their experience of the surgery and the recovery process. I'd like to begin by explaining a little bit about what it is like to go through the surgery. Anesthesia for surgery is usually via a spinal injection that numbs the legs for several hours. This allows us to avoid general anesthesia and the need to be on a ventilator during the surgery. Light sedation is typically provided so that patients still sleep through the surgery and wake up after it is complete. For various reasons, not all patients are able to have spinal anesthesia, and in those situations, we do use general anesthesia. I'd like to explain a little bit about what we actually do to the knee during the surgery, which typically takes about 60 to 90 minutes. A lengthwise incision is made directly over the front of the knee. We retract the kneecap out of the way and then expose the arthritic joint. Retractors are placed to protect the ligaments, blood vessels, and nerves. Bone spurs and loose bone fragments are removed. The outer ligaments are protected and preserved. A thin layer of the bony arthritic surface of both the femur and the tibia at the joint is removed and then resurfaced with a smooth metal surface. The metal surface may be cemented into place or simply secured with a friction fit if the bone quality is good. Next, a high-technology plastic surface called polyethylene is secured within the new metal tibia surface. Part of the kneecap may be resurfaced with a plastic dome depending upon the severity of arthritis affecting it. Just prior to closure, a mixture of medications designed to reduce inflammation and pain is injected into the capsule around the knee. The incision is typically closed with dissolving sutures and covered with an adhesive bandage that can stay in place until the follow-up appointment in about 2 weeks. Ultimately, each patient is unique in their experience of postoperative pain, and we work with each patient to help maximize pain relief while also transitioning away from narcotics as soon as possible. Studies show that patients who are still taking narcotic medication after week 3 are more likely to be taking it after 6 weeks as well, and this places them at higher risk for developing narcotic addiction. Because of this, we do everything we can to avoid having patients continue taking narcotics beyond a few weeks after surgery. Complications after surgery are rare, but they do happen. There are 2 main complications I'd like to highlight today that we tend to see from time to time. The most devastating complication after surgery is infection, which can require multiple surgeries over many months to eliminate the infection. As a result, the functional outcome after an infection is typically not as good as it normally would be. We do everything we can to reduce the risk of infection. Things you can do are to keep the leg clean, keep the bandage in place and avoid picking at the incision, keep the swelling down as much as possible, avoid prolonged time on your feet the first few weeks after surgery, avoid smoking. If you have diabetes, maintain good control of blood sugars. If you have obesity, losing weight before surgery is recommended. Now, let's spend a little bit of time discussing the recovery after surgery. As I've mentioned already, we typically see a lot of swelling and bruising in the first few weeks after surgery. It is extremely important to keep the leg iced and elevated above the heart as much as possible to limit this swelling. This not only reduces pain, but also lowers the risk of a blood clot and helps with knee range of motion. Some stiffness is common after knee surgery, and it is very important to begin actively moving the knee as soon as possible. We do not want to let the knee develop scar tissue that limits movement. Physical therapy is often scheduled to start in the first week after surgery, but we do not want you to wait until then to start your therapy. Therapy really begins with you starting daily exercises the day after surgery. Studies have shown that the daily exercises that patients do on their own at home are extremely important for obtaining a good outcome following knee replacement surgery. Patients who are diligent with these home exercises often require fewer visits with the physical therapist. Ultimately, every patient is unique in terms of their physical therapy needs, but do expect at least several weeks and possibly a few months of physical therapy. The most predictable achievement following knee replacement is pain relief. It is common to have only mild discomfort or no pain at all after recovery. Some mild persistent swelling is not uncommon, as are episodes of temporary increased discomfort after prolonged activity. You may also continue to notice some discomfort with weather change, especially during the first year after surgery. One thing to be aware of is that artificial knees can feel a little unnatural. They may click, grind, or clunk at times due to the hard surfaces of the mechanical parts of the artificial knee. These mechanical symptoms are not usually painful, but they can be alarming if you do not know to expect them. Most patients are able to return to normal activities after recovering from knee replacement surgery. You can expect to be able to return to activities such as golf, pickleball, biking, hiking, and extended walking. Running and jumping activities should be limited. Kneeling is more difficult to predict. Roughly 50% of patients find kneeling uncomfortable after knee replacement surgery. For those patients who eventually are able to comfortably kneel, it often takes 6 to 12 months. Almost all patients have some persistent numbness around their knee after the surgery that does not completely return to normal. It does not cause any major issue for patients, but it is helpful to know to expect it. We cannot precisely predict how long an artificial knee will last for each patient, as there are many factors involved. What generally wears down over time is the plastic surface. When I first started doing knee replacement surgery, we were often seeing the plastic wear out in as little as 10 to 15 years. Now, with advances in technology, we expect the polyethylene to last 20 or more years. In conclusion, I'd like to thank you for spending the time to view this video, and I hope that you have found it helpful. I would also like to express appreciation for the hard work of all of the people involved in helping patients through this process, including our clinic and surgery staff, anesthesia team, physical therapists, and coaches. I'd like to congratulate you on the courage of taking the first step in this journey by committing to the hard work of the recovery process that is required for a successful outcome. Thank you also for placing your trust in us at Door County Medical Center.